course, on the COVID-19 employment update. Along with that, though the update will be brief, will be a Q&A with Chelsea and myself, and we'll try to categorize how we're going to handle questions. So one is we'll prioritize questions that were submitted in advance. Then two is if you do want to submit questions during the webinar, we'd prefer if you use the chat button, which at least on my screen is in the bottom middle. So we'll then get to those questions secondarily. So I should step back. I guess we have to say good morning, everybody from Warroad to Waite Park, to Woodbury to Worthington, from Moorhead to Minnetonka to Mankato, and everywhere in between. So as consistent with our other webinars, we have a good crowd today. So what topics are we going to cover specifically in this webinar? First, with our brief update, we'll discuss Governor Walz's fourth stay-at-home order. Secondly, we'll talk about where public finances are and where the economy is, because obviously all of this is going to impact you short-term and long-term. Third, we'll give an update on what Congress is doing to help you, or maybe not help you as much as they should, for local units of government. Fourth, what we do find is very relevant to what's going to happen with the three preceding topics and what's going to happen to all of you as public employers. Where do epidemiologists, obviously Chelsea and I are not, but there are experts out there, especially at the University of Minnesota, who've given some real interesting projections, not to steal the thunder of that, but we are in a wave now, but the University of Minnesota is predicting the second and biggest wave is actually going to happen in the fall. Then after that, we'll spend most of our time on question and answers. And the way we're going to structure them and have one slide for each is we'll try to address what public employers should be doing or are doing related to their workplace conditions. Secondly, we'll try to address questions, even though there's some overlap, on employee medical and leave issues. And then third, we'll talk about those other employer actions like teleworking, furloughs, layoffs, salary reductions, hiring freezes, and the like. So those are our topics. Now, next, let's get to Governor Walz's stay-at-home order. So again, this was his fourth. Now, again, we can argue it's an extension, but bottom line, this is this fourth executive order. So what is happening in Minnesota, that's the context for his order and the context for what a lot of you are going to have to address as public employers. So obviously, much like the rest of the country, COVID continues to spread, and it's a combination of not only spreading, but now we have more testing, so we're able to specifically identify more COVID cases. So as of May 5th, Minnesota had over 7,800 cases of COVID confirmed by testing, but obviously public health is very clear. We know there are more out there, but that's the people who tested positive. And on May 5th, yesterday, we had the highest single day increase with 617 new positive cases. In addition to that, on two recent days in the last couple of weeks, April 26th and May 1st, both dates had the highest recorded death rate in Minnesota, primarily stemming from long-term care facilities of newly reported deaths. Now, what does Governor Walz and the federal government saying, but more specifically Governor Walz? Obviously, any further decisions of what they're going to do is not only the spread of COVID, but on reopening will depend on ramping up testing for the virus. Now, Governor Walz did state he hoped to have the state would be testing at a rate of 5,000 tests a day by May 4th. Again, we're close, but not quite there. So now let's talk about the nuts and bolts of the fourth stay-at-home order. First, it stays in effect through Sunday, May 17th at 11:59 p.m. And we're quoting this next one that is, obviously relevant for all of you, and it's something we'll talk about. We've had some thorny issues, especially raised by employees. It says that Minnesotans working in any field, which even include the critical sectors and the non-critical exempt businesses who were permitted to work in two of his orders, must work from their home or residence as much as possible. And it says any worker who can work from home must do so. So we'll talk about the thorny issues with that. In addition, he addressed mask and face coverings, as we are getting a lot of questions on that. He does concede they're not yet known to be protective of the wearer, though they are encouraged, and thus what is relevant, especially for your workforce, they are not personal protective equipment. So bottom line, he's saying we encourage it, but whether or not you're required it, and it should be personal protective equipment, is going to depend on, as Chelsea will talk about, the hazard assessments all of you should be conducting with your workforce. Now, the other component that he reiterated from his preceding order, the third order, was that, excuse me, if you're a non-critical exempt business, and I know the word business is used, but really we're focused on workers. So in Team Legal's view, that was sort of a loose word to use, business. We really think it's what is the worker doing, not necessarily whether or not you're a business. That you must establish and implement a COVID-19 preparedness plan. Now, we provided, the states provided a template plan, which we think has some deficiencies. On the other hand, we developed more of what we feel is more a targeted template plan for public entities that you can utilize, and we've linked it to our website. Now, in addition to that, our advice, which isn't necessarily consistent with the state advice, is one, you should have a catch-all public entity plan, even if you're not focused on non-critical exempt workers. As a general proposition, we recommend you have something of a semblance of a plan like the template, executive order or not. And a lot of what that plan addresses in the link, it does get into some of the specifics that we think are relevant, and that is especially how you're handling employees who either have symptoms, employees are at high risk, employees who've been exposed, employees who tested positive. We've done a very technical job consistent with CDC guidance that you can communicate to all your employees on how those should be addressed. In addition to that, we feel that you should have more targeted plans working with your department heads that supplement your general catch-all plan. So what's an example? Especially for public safety, you should have a more targeted plan. So as you can see in our template, we didn't structure it to get into the weeds of what personal protective equipment, masks, and the like, or gowns, et cetera. Instead, we recommend that be in a department, division, or employee group specific plan. So we think that's the best approach, because what you don't want to do in a citywide plan is to commit to doing things for all the workforce when in fact it may only apply to specific workforce. So again, we defer to our template on that. Now on the next slide, what is Governor Walz? Because a lot of you are thinking, well, what's going to happen post May 17th? We're 11 days away. We should get an announcement next week, likely, on any semblance of an extension or any semblance of what's going to be opened up. And Governor Walz has been using his adjust the dials approach. So the more testing that is done, the more the state is confident and can mitigate the spread of COVID, the more Governor Walz is saying he's moving the dial on what might be opening. So he's broken it down in a workplace, social settings, and school settings. So put school aside, nothing's going to be happening in the fall with that. But for all of you, the biggest thing, especially is the workplace, is, again, the more measures are in place to mitigate the spread of COVID, the more likely, and a lot of you, though this seminar doesn't address what are small businesses in your communities doing, because we're focused on you as public employers. Again, there may be a gradual reopening of your small businesses, but in the workplace, do we think there's going to be much of more of a door opening? That's to be seen, but we question for public employers if this next order is probably going to be status quo. But again, we'll see where they are at adjusting the dial approach. Then we get to, now we got the stay-at-home order. In addition, at the state level happening, or I should do one step back. One question we got is for public employers and private businesses alike, is what are the penalties for folks or employers as yourself for violations? Now, the order lays out consistent with statute. One is there's criminal sanctions. Two is there's criminal administrative penalties. And three is the Attorney General's office can pursue civil relief to individuals who violate it. Now, we've all read the headlines. We don't have a good database. We didn't really scour it. Now, we know is practically there's really not much enforcement, and we're unclear whether or not there effectively ever will be much more enforcement other than at large group gatherings. But again, all of you need to be cognizant. The violations are there, but whether or not they're being enforced, that's at a nominal level at this point. However, a lot of you are hearing and consistent with our webinars that the liability that we think could come into play, as we'll talk about in a Q&A session, is potentially from employees who may claim that, one, you're telling an employee, we think you're critical, you should be showing up to work, and that employee says, no, I can do all my work at home. You're forcing me to violate the order because Governor Walz says in his order, if you can work at home, you should be working at home. So we think potentially, though we haven't seen anything imminent, we're not aware of complaints, though we'd like to hear in the chat button if you've experienced that. We think that could be something forthcoming from employees who are fearful of COVID and don't want to show up to work. So we think that's where liability potentially could come into play for public employers. So there's a stay-at-home order. Now let's jump to quickly some budget and financial issues. So yesterday, Minnesota Management and Budget, the fiscal gatekeeper for the state agency, put out a interim projection, which they never do except in times like we are now, such as with COVID. And of course, no surprise, they said the state budget, the economic outlook has significantly worsened since they put out their entrenched February forecast. And they also said not only is it worsened, it's obviously very volatile, as all of you are experienced at the local level with your budgets and your organizations. So what specifically next did they say about the budget deficit? So the state is projected a budget deficit of $2.426 billion projected for the current biennium. And I want to clarify, that's monies that the state projects to expend through June 30th of 2021. And it started on July 1st of 2019. So what that is not only a deficit, but is a change of $4 billion from the February 2020 forecast. So again, no surprise, they do project a downslide in revenues by 7.4%. And what they are saying is things are so volatile, they didn't even want to go there and projecting what's going to happen with the next biennium to fiscal year budget, 2022 through 2023. But obviously they said it's clearly going to be a negative impact. So there's the budget. Now, what do they say about the economy? That's relevant for your finances and especially from the public employment end. What are you doing with employees? So one, they expect the economy to tank, no surprise, by 5.4%. Now, their consultant, though the state board who oversees the consultant and really guides the state and what they're going to do with budgeting, says that real GDP growth, that is, or the economy itself, will reach its pre-pandemic level in mid-2021. So what their consultant projects is 5.4% decline 2020, 6.3% uptick in 2021. The state board, the economic advisors say, no, we don't think that's reality. They project a much slower recovery, even though a lot of deference is given to the consultant, because one, they say a possible more persistent outbreak that Chelsea will talk about is likely, it's going to happen in the fall. And two is a longer period of social distancing, especially triggered by a more persistent outbreak and a bigger wave, is likely going to make the recovery slower. So that's what the state was considering in its budget projection. So now in the next slide further, what are they saying with the economy? One is they expect the U.S. to regain full employment at some point, not until 2024. So bottom line, 30 million people in the U.S. are unemployed. We're probably not going to recover what's going to happen with COVID until 4 years from now. So that's a real problem if you're looking at your workforce and the numbers and what may happen with all of you. So again, bottom line, 30 million people nationwide to this point since mid-March have applied for unemployment. Close to 600,000 Minnesotans. Now we know every week that number is going up. And then we'll get unemployment figures in mid-May, what the percent is at. So their consultant, the state, says unemployment will reach a high of 10.3% by the fourth quarter of 2020. Now, again, a lot of consultants that you see think it's going to be higher, could be pushing 15 or 20%, but that's where the state's at. So on the next slide, let's be cognizant. If you look at what the state, take into account, how did they get to their budget deficit numbers? Is that they expect the spread of COVID to peak and then dissipate per their consultant in calendar year 2020. And two is that restrictions will be lifted during the third quarter. That is starting in the summer. Now, again, as we'll talk about, that's probably not realistic. So even the state concedes their budget deficit is probably just going to be worse, and they're going to submit some update. So then we go to the next slide. What's going to all this depend on where the economy is going to go, where the budget's going to go? One, where does the pandemic go? Two, what are the prospects for effective treatment and vaccine? Three, how is government, based on that, going to restrict economic activity? Four, how are consumers and businesses going to respond? And then five, how's that going to impact, especially at the federal level, what's going to happen with fiscal and monetary policy? So none of this to give you certainty or reassurance. All we know is it's bad, but the projection, the badness of it, much more likely leans towards, as Chelsea will segue, it's probably going to be worse than they predict. And I think that's no surprise to all of us. And that's going to impact not only what you do now, but especially for all of you entering budget season, what's going to happen in 2021. So now we'll shift gears back to one other thing is in the federal legislation, the CARES Act, $2.2 billion in emergency aid went to the state. Now, under the law, the state must expend that money or return it by December 31st. So what happened with that money that went to the state? Obviously, the chunk of that 1.87 billion went directly to the state, then Hennepin and Ramsey County. Now, neither Minneapolis nor St. Paul got any direct allocation from it, and obviously none of the rest of you, because they're both under 500,000. But Chelsea will talk about a projection, but with the money the state has, is the Minnesota Management Budget said that the state can expend $667 million of the aid it's already received can go to local government for pandemic-related expenses. Now, based on what's happening in the legislature and the governor's office, there's really no clarity on how that money is going to be expended and who's going to get that $667 million. But the bottom line, we know it's confined to, for all of you as local governments, if you're going to get any of it, it has to be related to pandemic-related expenses and not just broader, we've got revenue expenditure problems. And no matter what, if you're going to get it, you're likely going to have to prove up it's a pandemic-related expense. But more is going to be forthcoming once the legislature and governor come together. Now we'll segue to what's happening on the congressional level as a projection. So Chelsea, will shift back to you.
Thanks, Brandon. Although no one has asked this as a question yet, yes, my background, if you're able to see me at this time, is from the TV show Parks and Rec. So just in case that does come up and someone thinks it's familiar, because I'm in a shared workplace, thought that would be an appropriate background. So just to touch quick on the federal update. So what is Congress doing related to COVID-19? So there have been several bills introduced are set to be introduced in Congress this week, seeking to provide assistance to local governments. In general, that includes both federal aid and language amendments to the Families First Coronavirus Relief Act, the FFCRA, and also the Coronavirus Aid, Relief, and Economic Securities Act, so CARES. And so one of these bills would amend the FFCRA to extend eligibility for paid leave payroll tax credits to state, local, and tribal governments. I know the House has already introduced legislation to this effect. It just has been introduced. There hasn't been any further action taken on it, but it's expected that the Senate will also be introducing a similar bill. I do not think that that has happened yet. With the CARES Act, there's also expected to be legislation introduced that would allow cities and states to use funding authorized in the CARES Act for lost revenue due to COVID-19. And on a similar note, but rather than amending the CARES Act, there's also a separate Coronavirus Community Relief Act, a bill which has been introduced in the House, I believe, but the Senate, that's something that is expected to be introduced in the Senate this week, and that would seek to provide $250 billion to local governments with a population of less than 500,000, as those entities were excluded under the CARES Act from receiving federal aid. And now turning to COVID-19 projections. So looking at what the next year, 2 years might look like, there is a group, the Center for Infectious Disease Research and Policy, that is actually housed out of the University of Minnesota. So that group put together a COVID-19, the CIDRAP viewpoint is the name of the document that they prepared, and it was prepared by several doctors and other professionals from related disciplines working together to look at how the influenza pandemics in the past have played out, and looking at that as the best comparative model for projecting what the COVID-19 outlook might look like. So based on that, and taking into consideration that there are some differences, which are noted on the slide, include a longer average incubation period. So with the flu, that's generally thought to be about 2 days, and with COVID-19, based on research thus far, we know that the average incubation period is more like 4 or 5 days. And in addition to that, a higher asymptomatic fraction for COVID-19 in comparison to influenza. So with influenza, there's also an asymptomatic fraction of people who don't show any symptoms, but with COVID-19, that is thought to be a higher percentage of people. So based on that, they are projecting that the outbreak will last between 18 to 24 months in total, and that the pandemic likely won't be halted until at least 60 to 70% of the population is immune, because that is thought to be the critical threshold of herd immunity. Of course, there's different projections out there, but this is one that has been released by this group in particular. And then also with this CIDRAP viewpoint that was put out related to COVID-19, they put together 3 possible scenarios based on how the flu pandemic has played out in the past. And so looking at, you can see the graphic on the right, so that shows the 3 possible scenarios that this group has put together based on how the flu pandemic has played out. You can see the first scenario at the top, the third scenario down at the bottom. So on the y-axis, you have COVID-19 cases. So with the valleys, you're seeing the high impact of COVID-19 cases. And then on the x-axis, you see the months. So that's spanning out for the next 2 years. So based on these 3 possible scenarios, the first scenario you see at the top shows the current first wave of COVID-19 that is then followed by smaller waves, and that goes through the summer and then consistently over a 1 to 2 year period. So with that, it's possible that there may need to be certain mitigation measures reintroduced depending on how high those peaks get, which will depend on of course, could vary geographically. We're seeing that now, but also what mitigation measures are in place and how they're eased. We know that that's obviously going to look very differently in different parts of the country. So looking to the second scenario, this is thought to be the worst case scenario, which is titled here as the fall peak. So the second scenario has the first wave that's then followed by a larger wave in the fall or winter of 2020. And then beyond that, 1 or more smaller subsequent waves in 2021. So with the fall peak, as I mentioned, that's thought to be a worst case scenario, both because, of course, with the second peak, that would mean that likely mitigation measures would need to be reintroduced at that point, because the healthcare system would be overwhelmed at that point, as it is in certain parts of the country currently. And again, that would look differently in different parts of the country, but that's in general the fall peak. And with those mitigation measures, if they are reintroduced, that would have a significant impact on the economy as well. So as Brandon mentioned, those projections will be dependent in part on how the pandemic plays out, and this will depend on which one of these scenarios, or if it's a different but similar scenario, which one of those occurs. And then finally, with the third scenario that you can see at the bottom, so this shows the first wave followed by what's called a slow burn of ongoing transmission in case occurrence, but without a clear wave pattern. This isn't something that this group who put together this document and study, they haven't seen this happen in the past with the flu pandemics and using that as a model, but it is something that could happen with COVID-19. It's just not known at this point. So those are the three possible COVID-19 projections. And then now we're going to move on to our Q&A session. So I know we have gotten some questions already. So the first category, as Brandon mentioned, we're going to try to keep these segmented into different categories just to organize the flow of questions. And then finally, we'll have a catch-all at the end for questions. So at that point, if there's a question that you think of, but it's not necessarily in the category that we're currently discussing, you can bring it up at that point. So first, to touch on workplace conditions. So that would include questions on personal protective equipment, questions on distancing, questions related to sanitary conditions. We really haven't seen any specific questions on distancing or sanitary conditions that we've gotten in advance. Obviously, if they come up now, we can discuss those. We have gotten a number of questions related to personal protective equipment. So looking at one question we have gotten already is the question asked was whether cities are creating a preparedness plan and if they will be utilizing the health questionnaire template and or temperature checks when employees return to work. We know that some cities are creating a preparedness plan. As Brandon mentioned, it's been a little unclear at this point whether cities who have been operating as as a critical sector, if they're bringing employees back to work who weren't previously working, just depending on the nature of their work. It's still thought that having this plan in place is a best practice and is arguably something that cities are required to do. So that being said, and I'll touch on this a little bit with employees' fear of returning to work and how having this plan works into that, but I know that is something that cities are creating. And we have heard from a few cities already about implementing temperature checks and how exactly to go about. I don't think we've gotten too many questions up until this point about logistics of temperature checks, although maybe one or two at this time, but it's not something we had advised on previously, but a lot of questions related to consent forms that need to be given to employees or Tennyson notices related to temperature checks. So as we mentioned in a previous webinar, when this private information, temperature checks, or you're asking employees if they have COVID-19 symptoms, that is a time where under Minnesota law, you would have to give employees a Tennyson warning. And we did have one question previously about whether it would be possible to have employees provide their consent to temperature checks, or whether it's that or health questionnaires, and have that be valid for a duration of time. Maybe it's several months. That is something that cities could consider doing, so that's not, you're not worrying about providing a Tennyson and going through that process over and over again. That is an option. With data privacy, this was posed as what are other cities doing to ensure data privacy for this medical information. It is important that any of this information, because it is medical information, that is kept in a confidential medical file on the employee, separate from their personnel file, which should, even though it's part of their general employee file, that should only include certain information and not the medical information. So that should be kept separately, so that if you have other employees putting things in personnel files, going through information, they're not also accessing that confidential medical file. And we do have another question about, so employees who are currently working from home that may be stressed about having to integrate back into the public and the workplace, that have fears of becoming ill, what's the best way to help them deal with those stressors and ensure a smooth transition? So as I mentioned, the preparedness plan that Brandon mentioned, what that should entail in part, we really do think that, although it may be arguable whether it's something that cities are required to implement, we do think that it's something that cities should think through and implement, and have that as the preparedness plan that is communicated to employees and posted. And having that preparedness plan is likely to ease some of those fears employees might have about returning to the workplace, if they know what the city has thought through and put into a plan for a variety of different scenarios, whether an employee who may have a spouse at home who's sick, or a child, or if they're experiencing symptoms, that there is a step-by-step guideline there of what the city is going to follow related to responding to that, and having that communicated in writing before an employee comes back to the workplace is likely to ease some of those fears, because a lot of that might just be coming from the unknown of the situation. But also, if you have employees who are proactively saying that they're scared about coming to work at this time, you're engaging in a conversation about it, seeing if there's something in particular that the employee is worried about, and whether you can address that. Maybe it's something that wasn't, it didn't go into detail in the preparedness plan about how the city is going to handle that, or other entity. And then communicating to the employee, and then because other employees may have similar questions, making sure that it's communicated, this is something that we hadn't thought of before, but here is our plan for addressing that specific concern that was brought up, if you think it might be a question other employees have as well. So I do think having that plan in place and communicating it will help ease a lot of those fears. I'm just looking at some of the other questions that have come up. I'm seeing questions related to masks. So get to masks, because that is a question that we have gotten. So, okay, one question we got regarding masks. So as cities are preparing to open city halls and thinking of face masks, and there has been specific guidance from the CDC, related to PPEs for certain employees like first responders, and what's provided in that guidance is pretty specific as to what that recommendation is. But we have gotten questions, and as this question asks, who should be wearing masks besides first responders? Do staff such as Public Works have to wear those masks when they're working outside? And how do you handle that? So with employees beyond first responders, where entities have gotten more specific guidance related to personal protective equipment, or cloth face masks in general for employees, if that's something that as an entity you would like to implement a policy related to that. Looking to Public Works as an example. So if you have Public Works employees who are working out in the field, they're outside, they're not likely to come into close contact with other individuals for a prolonged period of time. So per the CDC guidance, that would be within 6 feet from the CDC has said a prolonged period of time is 30 minutes, although the Minnesota Department of Health has said that's likely around 10 minutes. So prolonged period of time, if you want to think of that between 10 and 30 and maybe err on the side of caution with that, if you have employees who are having that close contact as part of their job functions, that's when you would need to think about whether you should require those employees to wear masks. If you have public works staff who are working outside, that's likely not a time where that would be necessary. However, there are possible other scenarios and job functions where that close contact would happen. I know some entities have required building inspectors who are going into other homes on a regular basis. They're requiring masks for those individuals in those positions. Otherwise, we do recommend that entities have a plan in place if you are either, just to answer that question in general, but if it's voluntary, if it's required, and then specifically clarifying which positions that's required for, if it's implemented at a department level, making clear that, for example, the police department has in their policies and procedures clarified what this policy is related to personal protective equipment and masks, and this policy, if an entity is implementing one, that this does not supersede that departmental policy is something that you should make clear, so there's no questions about whether that a new policy or notice that's issued to employees about how that interacts with any previous policies or procedures that employees would have been aware of. And looking to see if we have, I know there has been questions about paying for, is a question that we've gotten previously about paying for personal protective equipment. So there's of course the question as to whether entities are going to require employees to wear certain masks or face covering, or have that be a voluntary policy, and just clarifying when masks can be worn, when they should be worn. Under Minnesota OSHA, but federal OSHA has the standards. If you are requiring personal protective equipment, that is, we do have some guidance on that OSHA has stated that employers are required to pay for personal protective equipment. So if that's something that you're requiring for other employees, that is a time where it's generally thought that employers would have to pay for that. However, as Brandon mentioned, cloth face coverings, other types of masks that aren't known to be particularly protective for the wearer, it's more for source control. That's not thought to be PPE. That's been stated both by the governor and the CDC. So, if that's something that a city is requiring, or other entity, that may be something that an entity wants to pay for if it's being required, but it's likely not required, at least under Minnesota OSHA and federal OSHA standards. So, but that being said, that being a difference between a respirator such as an N95 mask or surgical mask versus a cloth face covering, there is a difference. So it will depend on what type of a mask is being required or is part of that voluntary policy. So it should be clear what exactly is being required. And yes, employers can require that masks be worn. That can be required as part of a condition of employment. One other side issue to think through is that there could be a situation where an individual has, if they are a qualified individual with a disability under the ADA, that they may need some different equipment as a reasonable accommodation. So just making sure that as the employer, you're thinking through what sort of reasonable accommodation might be available and having that interactive discussion with the employee. Okay, I'm not, let's see. I'm not seeing other questions related to workplace conditions, unless Brandon, if you've seen any.
Yep. So one question we did get on workplace conditions was if you one is especially for public works folks, we want one employee per vehicle. Obviously, you can't maintain 6 feet distance in a vehicle. But what if that's just not practicable? That having employees use their personal vehicle raises liability or mileage issues. Can you have 2 people in the vehicle? Now, again, the state doesn't say, look at, you're violating the order if your workers are not 6 feet apart. The state is not black and white, nor is any other regulation. Now, that's ideal. So in that situation, the hypothetical is brought up by this administrator, can those employees be in the same vehicle, public works folks, so as long as they have masks? So one, I think you got to take any and all precautions if you can't keep them 6 feet apart, which may include masks, which may include gloves, which may include other PPE, even though practically not in the vehicle, and may also include, make sure, that's why you should have a plan and notice in place of how you're going to clean that vehicle and disinfect it and encourage the hygiene of the employees. So as long as you have all those other measures in place, you're likely not going to have a problem with the stay-at-home order or OSHA, because again, there's no black and white law that says employees have to be 6 feet apart or you're going to violate something. So make sure you take other precautionary measures. So full circle with precautionary measures, you can have, for example, 2 of your public works folks in the same vehicle, though not ideal. So that's another workplace condition question we did get. So Chelsea, maybe we want to move to the next slide on leaves and medical issues. And I just want to clarify, the question and answers brought up about temperatures. And Chelsea brought up the Tennyson warning and consent. So those are 2 things. If you Google that issue, you don't see Tennyson and consent. That's a Minnesota thing. So we're very clear in it. For those who we work with, which are dozens of you, we're very particular on that. So we do have a model Tennyson and consent warning that is applicable even if you just do the health questionnaire. Like I know the League of Minnesota Cities put out a model, and or do temperature checks, where we think using that Tennyson consent will be permissible to do it on an ongoing basis without having, each time you take a temperature, each day you ask them questions to give them the Tennyson and consent. So we put out a model form. Another question was asked on temperatures. Are we somehow violating the order, governor's order, CDC guidance, or a preparedness plan by not checking temperatures? No, you're not. And one of the medical reasons why is we are not seeing that much, except, for example, in correctional type settings, or health settings, where you're in close contact with people and it's real imminent spread because of the group settings that you can't avoid. Is fever is only one of 6 symptoms now that CDC says is an indicia of somebody who may have COVID. Now, ideally, per the model preparedness plan, per CDC guidance, you still want people with a fever to go home. But again, we just think medically, because that's not the catch-all and it's so burdensome, and then you've got reliability issues, you've got who's going to be doing it, are you actually administratively going to be recording it? So to be blunt, unless you're in healthcare and corrections, you're probably not doing temperatures, and we don't really think it's that prudent or practical for a lot of our entities to do it, and you're not required to do it. But what we do emphasize in our model, more local government-based preparedness plan, is that you got to be clear with your employees. If you've got fever, if you've got chills, you've got flu-like symptoms, stay home. Now, all of you, a question comes up is, great, now if somebody's got the sniffles, they can argue per our preparedness plan they should be staying home. No, we try to break it down into what are our more concerning symptoms. Having a sneeze or the sniffles in allergy season is generally not enough. We basically say, 1, look at your symptoms, and we spoon feed it. In the past, I think all of us have been a little guilty in saying, all right, employees, just look at CDC guidance to figure out if you should stay at home. So we morphed it and said, no, we felt we had to be more technical in our preparedness plans that, again, we recommend all of you have it. Put aside the critical or non-critical exempt business or the governor's stay-at-home order. We think is a good tool. So we've broken it down by CDC guidance. If you have symptoms X, you should stay home and report to supervisor, which means your supervisor should be trained. If someone just says, I've got the sniffles, generally you want your supervisor to have that plan out and go, what else is happening with you, and then see if they should be staying home. We also talk about folks if they've been exposed or if they're high risk or if they tested positive, what should you do? So in lieu of going through that like we did in the last webinar or in our plan, again, we defer to that. So one quick thing that sort of segues from medical and leave issues, unless Chelsea had anything specific on that you wanted to address before we get to the next slide.
No, I don't think we had anything specific for leave issues. I mean, I know, Brandon, you touched on, unless you wanted to go through any sort of hypothetical situation for employee medical, whether that's exposure, high risk. I think it doesn't look like we have any new questions other than it was asked if we're providing the slides, if that'll be online somewhere. The slides will be on the CGMC website. And so that'll be uploaded to the CGMC website pretty shortly after the presentation.
All right, so now we'll segue to the next slide because we did get questions on that, and that is other actions that you're taking with employees. And so this is, again, just a segue, performing long-term tasks, doing duties from other jobs, and teleworking. Now I want to pause on the telework. And the scenario we had again was governor's order said, even if you're critical, that if you can work from home, you should. Now, we had a debate with or not a debate, but a healthy discussion with an employer and an employee. Employee was deemed critical, and they were allowed to work from home continuously for a couple weeks. But because of the fact they're in a supervisory position, and because of the fact this position required a lot of interaction with the public, albeit by phone and emails, and they supervise people, the employer said, look, this is not working, having you at home 40 hours a week and not coming in except to pick up paperwork after hours when no one's around, because of those two main factors: public contact and controversial issues, and 3, morale problems. The employer has transitioned and told that employee, look, we need you here at least 20 hours a week. And we need it, by the way, 5 days a week, because we've got a high volume for 4 hours, chunks of time a day. We need you in. The employee said, no, governor, they cited and quoted the governor's order that said, if I can work from home, I should be. Secondly, I've got children issues at home, so I've got protection there. So the way we negotiated that one is say, well, we think your interpretation is wrong. We actually do need you to work for a chunk of time. It's not all the time, because in effect, you can't be doing your job, especially as a supervisor, 40 hours a week without that direct contact, so albeit socially distanced from employees. And but we said, all right, as a compromise, we understand your children issues. By the way, if you're not able to work 40 hours a week, home or at work, you've got protected leave to do that. That's not an excuse for us to say you don't have to work. But if we tell you got to work, you have to. And if you can't, then you can take protected leave. But then in the back and forth with the employee, they're going to basically phase in and transition the employee back. Instead of doing the 20 hours a week, we're going to get them back 6 to 10 hours a week and hopefully up to 20. So those are the types of micro practical things you're going to have to work out with employees. And we duly understand that there is morale issues, especially with subordinates or maybe doing higher level work, which we opine with the employer that could cause a union issue, because the subordinates were unionized employees, clerical employees who said, we're basically gap filling for the supervisor who's not here to deal with this. So we think they could be angling for getting what's called out of class pay, higher level duty and responsibility pay. So that was part of our question or part of our issue of why we said to the supervisor, you need to be back. So those are the types of compromises. Now we get through some of the other issues. Beyond telework, we've also got furlough issues. Now, a lot of you with park and rec programming, it's basically being eviscerated in the meantime. And maybe depending on where the pandemic goes, maybe you're not going to have your aquatic center open at all. That could be a legitimate issue for some of our cities who have that, or their county park programming, et cetera. So with your mid-level managers or supervisors who are FLSA exempt, there is a real issue, and we're going to put out more concrete guidance on this, is it's always wonky on how you can effectively reduce hours, but then reduce pay because you want some budget savings because you're not bringing in that park and rec revenue to support funding that mid-level manager position. So here's where the divide is between legal preference and practical preference. Team Legal's preference is for an FLSA exempt employee to not worry about their FLSA exempt status and being subject to minimum wage, overtime, and record keeping, is you should furlough them for chunks a week at a time and tell them they can't be doing any work. You can't be checking emails, phone calls. Then that way that's clean. You don't have to pay that person's full salary for a week. But what we do know from hearing all of you, well, that has zero practicality. So, which means we only want them working a little bit, even if they're at home. We want them checking emails, because if you check emails as an FLSA exempt employee, that's enough to trigger the employer's obligation to have to pay you for a full work week. So then we say, okay, another easy way to minimize the cost, or potentially get cost savings with their salary, is if they're off at day or more chunks and don't do any work for a day or more, and it's voluntary. So basically the outreach that we've had with other mid-level managers is, we need to find cost savings. We're going to try to keep you employed here, but we need to get some cost savings for their salary. So will you work with us on a furlough? Now, of course, all of you know, to step back, especially in a unionized environment, you got to put out more formal notices. And I'm talking about, those are online. We've talked about those. I'm talking about these micro practical discussions with exempt employees. Is you say, if we're going to have you days off and chunks at a time, we'll reduce your pay. If you're off one day, it's 1/5, or 2 days, it's 2/5, but it's got to be a day at a time. And you can't be doing any work for that one day. Now, some entities are still balking, going, come on, we still need them 5 days a week. Let's just shave it to 4 hours a day. So it's either week chunks or day chunks. The other option is to do partial day time off for that employee, where you reduce their pay by the corresponding amount. Now, that's only okay for an FLSA exempt employee, and this is a carve out where the FLSA benefits you as public employers. It says if you're doing a budget required furlough, an individual who is absent, let's say for a half a day, and again, it's voluntary, you can reduce their pay basically for those 4 hours, but only if you have a policy that says if you're absent for 4 hours a day, for example, or partial day, and it's voluntary, and you don't want to use paid leave, then we can reduce your pay. So we've been working with cities or counties who haven't had the policy in place that the regs say you should have. And we're amending your personnel policies right now to have that express carve out, because the law is clear. If you don't have that policy, you can't reduce an FLSA exempt employees by partial day absences. So again, something to work on, get your notices and policies in place. Another question that came up is, what are we going to be doing about union negotiations? What's going to happen with local government funding? So one related to negotiations is, one, generally, to be blunt, especially at the front end doing negotiations, we think it's premature to negotiate for 2021. Get through your budgeting process, see where the economy goes, see where the legislature and Congress go with funding anything. See, for those of you reliant on LGA, where that's going, because we got to tell you, I know the question was asked, where's LGA going to go? Too wild of a projection, especially as the labor and employment attorneys, but obviously we have lobbyists in our office. We don't really know yet till all this is sorted out. So we feel, take a time out in 2021 negotiations. There's a lot to sort through, get through your budgeting process, then maybe let's talk to the unions. The only exceptions we're seeing is for those who haven't resolved the contract for 20, or for those of you who need to do salary reductions and furloughs, which is still a minority of you, though we think it's going to pick up, may have to negotiate. So that's the only people we see negotiating. We recommend take the time out on 21. Let's get all our stuff in order. Then we can start talking to the unions about negotiations. Now, other entities are moving ahead, especially looking at your park and rec programming or other mid-level management positions or other frontline positions that you think, especially in 21, you're just not going to have, is we're going back to where we were in the recession with potentially early retirement incentives. So a lot of you should blow the electronic dust off your 10 or 11-year-old documents for early retirement incentives and start bringing those back. And for those who need a quick primer, that's where you want to reduce the overall workforce because you can't afford it for 21. So basically, you tell employees close to retirement, if you leave earlier than you projected, we'll give you some more compensation. A lot of you do it towards health insurance in lieu of you, one, agreeing just to voluntarily resign early, and two, in exchange for that, we enter an agreement where you promise not to sue us over related to any of this. So a lot more of you are doing that to get people to voluntarily lay off, which we still feel is the best approach. Try your furloughs, try your salary freezer reductions. Then unfortunately, like the larger cities, the Duluth and Minneapolis of the world have already started their layoffs. So again, try to get back to the voluntary component. Then we get to one quick question somebody had on exposure to COVID-19. I'm going to default to our local preparedness plan. And specifically, CDC has very specific guidance. If you have a frontline public safety worker who's been exposed to a known case of COVID-19, there are very specific CDC guidance on how you should handle that person. If you're not public safety and you've been exposed, you should be home 14 days. But because if you want public safety to keep working, CDC has given guidance that says, here's exactly what you do to a public safety worker or a healthcare worker or emergency responder who's been exposed at the workplace. There are certain mechanisms you can take place, which includes some short-term isolation, but you can bring them back sooner than a non-public safety person per CDC guidance. So one, we're going to default to our local preparedness plan. Two, there's specific CDC guidance on that. And I think, Chelsea, any other questions we didn't get to in our few minutes left?
There's one question that I think I should probably follow up with this individual just separate from the webinar, but just to touch on one aspect of that, it's related to federal leave. So with the emergency paid sick leave and emergency federal or family medical leave, so those are leaves that would run concurrently. So if someone is eligible for both emergency paid sick leave and the EFML, that would although the first 10 days or 2 weeks of EFML can be unpaid at that time, you would also start running the EPSL, the emergency paid sick leave. So yes, those would run concurrently.
Yeah, and if, bottom line, we say if an employee is eligible for emergency family medical leave, you can, in effect, force them to be on it. So it's not like Chelsea said, take your emergency paid sick leave, your 2 weeks, and then start EFML. Bottom line, run them concurrently, and that EFML member counts towards your 12 weeks total of FMLA leave for other reasons. So it's a combined 12 weeks.
And I think, unless there are any other, we're almost out of time, but if there are any other questions that might not have fallen into the category that we were on at the time, just looking through quick here to see if there's anything that we're able to answer quickly. But other than that.
And while Chelsea's looking, again, we've got our resource, our link, especially at the bottom of the COVID-19. We're continually updating it. So even if you got an alert or looked a couple weeks ago, on occasion, we do update it. For example, our notices of layoffs have been updated. So again, we try to make our templates more user-friendly as well. But we will be doing future webinars, one on negotiations, two, likely have a panelist of employers, but three, please do a survey at the end of this that will be pop up for you when you leave the meeting to tell us how you think this went, how productive, and what you want to see in the future. So we do appreciate your feedback. and we appreciate all your time this morning. Again, definitely feel free to follow up with us. So thank you and good luck on your preparedness planning.